Good morning, everyone. My name is Shirly Leton, and it is my distinct honor and privilege to present my DMP scholarly project to you today. The title of my project is The Effectiveness of Immunochemical Tests in Increasing Access to Colorectal Cancer Screening Among Active and Retired Military Personnel and Their Dependents. As a clinical nurse in a primary care setting for the past 5 years, I have provided care for patients who were due for colorectal cancer screening, patients who were eligible, who had access, and who still walked away unscreened, not because they did not care about their health, but because the process felt invasive, uncomfortable, and inconvenient. I wondered to myself, would there be an uptake of colorectal cancer screening if patients were offered something easier, something they could do at home on their own time without sedation, prep, or time off work? That question became the foundation of this project. Before I begin, I want to acknowledge my committee members with sincere gratitude. My project chair, Dr. Kelly McFay, my second reader, Dr. Boniface Degnan, my community member, Captain Anna Halogen. Introduction. Colorectal cancer screening is essential for early detection, management, and preventing colorectal cancer-related deaths. According to King et al. 2025, the rate of colorectal cancer screening is 61.4% compared to a target of 72.8% in healthy people 2030. Military personnel are at lower risk of developing colorectal cancer compared to the general population, although the rate of colorectal cancer screening is higher among active and retired military personnel. There is need to implement an evidence-based colorectal cancer screening modality to address missed screening opportunities. Few studies have examined the effectiveness of FIT program in increasing colorectal cancer screening rate among active and retired military personnel and their dependents. The aim of the project was to implement FIT program to increase colorectal cancer screening among active and retired military personnel and their dependents. The purpose of the study was to examine the effectiveness of FIT programs in increasing colorectal cancer screening completion rate among the population, expand screening access or coverage. This DMP project used a quantitative retrospective comparison design to answer the Fecal question. Among active and retired military personnel, how does colonoscopy combined with FIT compare with colonoscopy alone in increasing colorectal cancer screening completion rate and expand access to colorectal cancer screening? Background. So how does the statistics of colorectal cancer deaths and screening among the active and retired U.S. personnel, military personnel compare with the general civilian population? According to Adenislet for 2024, colorectal cancer is the second cause of cancer-related deaths in the United States population. Annual incidence of about 153,000 cases. The previous mentioned authors also asserted that the Veterans Administration diagnoses approximately 4,000 new cases of colorectal cancer annually, and it accounts for 9% of all the cancer cases in the VA. Overall, there is a higher rate of colorectal cancer screening among active and retired U.S. military personnel compared to the general civilian population. A study by Wegand et al. 2025 found that active and former U.S. military personnel were 5% more likely to be screened for colorectal cancer than the civilian population. Study also affirmed the previous findings by reporting that endoscopic colorectal cancer screening among the former and active U.S. military personnel and the civilian population was 78.44% and 68.62% respectively. The higher rate of colorectal cancer screening among active and former U.S. military personnel can be attributed to improved access to healthcare services and health insurance coverage compared to the general population. However, there are notable differences in colorectal cancer screening among this population as indicated by disproportionate screening and colorectal cancer-related deaths. The disproportionate colorectal cancer screening suggests significant gaps in screening for a population that have access to quality screening services. Consequently, there is need to increase the rate of colorectal cancer screening among the active and retired military personnel by removing barriers to screening. Studies suggested that intensifying grassroots campaign can potentially address the screening gaps. Since the U.S. military personnel prefer the non-invasive FIT screening to colonoscopy, introducing FIT screening program may increase colorectal cancer screening completion rate among active and retired military personnel and their dependents. One might be wondering about the unique features that makes these sites the appropriate for implementing FIT screening modality. Notably, the sites utilized colonoscopy as the conventional colorectal screening modality. Besides, the sites kept relevant data to track screening status of the patient they served and maintain a system of communication with clients. However, patients missed opportunities for colorectal cancer screening despite facility constant communication. Moreover, the site set an annual colorectal cancer screening completion rate of 65%, but achieved only 53%. Therefore, the aim of the DMP project was to examine the effectiveness of FIT in improving colorectal cancer screening completion rate by expanding access to the colorectal cancer screening. FIT was implemented because it is more affordable and can be combined with colonoscopy modalities. Literature review. The most common colorectal cancer screening modalities are colonoscopy and FIT screening. Colonoscopy is often used to confirm positive FIT test. However, FIT can be used as a standalone colorectal cancer screening modality or in combination with other modalities. FIT is more effective in screening or increasing colorectal cancer screening completion rate even as a standalone colorectal cancer screening modality. Besides, one can mail FIT kits to increase the response rate and colorectal cancer screening completion rate. U.S. military personnel prefer FIT screening to colonoscopy with greater preference reported among the African American military men because FIT is characterized by a few or no complications. It is simple, non-invasive screening procedure, and individuals can perform the test at the comfort of their homes. Most of the studies reviewed had large sample sizes. For example, the cross-sectional study by Wegand et al. 2023 recruited 855,704 participants and a randomized controlled trial by Gruner et al. 2020 that compared mailed and enhanced mailed FIT program recruited 17,532 participants. The findings in these studies could be generalizable to other populations. Moreover, the researchers adhered to ethical requirements, with most researchers reporting that their studies were approved by respective IRBs. Lastly, the researchers described the methodologies of the studies to facilitate reproducibility, and collectively, the findings of these studies had a direct effect on informing the DMP project's aim. Variable methodologies. For example, its principal investigator included male FIT program order to improve response rate and increase colorectal cancer screening, since previous scholarly work had revealed that male program and enhanced male program can potentially increase colorectal cancer screening rate. Also, the variables of the study were based on outcomes of literature review. This principal investigator implemented FIT program because past scholarly work revealed that active and former military personnel preferred FIT and suggested that FIT can increase colorectal cancer screening as standalone or with other modalities. Consequently, this principal investigator combined FIT with colonoscopy in the post-intervention group. Although past scholarly works on colorectal cancer screening among active and former military personnel agreed that the military servicemen prefer FIT screening, and studies have been conducted to investigate the effectiveness of FIT in increasing colorectal cancer screening completion rate. No study have been done in active retired military personnel and their dependents at the sites. Past scholarly works have been dedicated to examining the patient's preference on colorectal cancer screening modalities. Studies found that the civilian population prefer non-invasive FIT screening modality to colonoscopy. Von Wagner and O'Leary extended the research on patient preference to clients from disadvantaged communities. They found that clients from disadvantaged communities preferred FIT screening. A study by Robertson 2023 is the only study known to the principal investigator that examined the effectiveness of FIT program in increasing the proportion of colorectal cancer screening among active and former military personnel. Consequently, there is need to investigate the effectiveness of FIT in increasing colorectal cancer screening completion rate and expanding colorectal cancer screening services. Theoretical framework. This project was guided by the health belief model. The health belief model was developed by social psychologists. They developed the health belief model to understand the common failure of screening programs for tuberculosis. Researchers have employed the health belief model to investigate health-related behaviors such as screening for early detection of diseases to unravel the reason for refusing to have screening tests. The health belief model, according to Alfier and Eston Carr, they explained that the health belief model is appropriate for assessing the effectiveness of community-based interventions. The health belief model has 6 social constructs, including perceived severity, perceived susceptibility, perceived benefits, perceived barriers, modifying variables, and cues to action. The social constructs for the health belief model guided the intervention, design, methodology, and interpretation of the DMP project. Perceived barriers refer to the obstacles to behavior change that individuals encounter. The pain and complications of screening procedure may be a likely barrier to screening for traditional colonoscopy. Therefore, by introducing a non-invasive FIT screening, this principal investigator hoped to reduce barriers to screening. Additionally, FIT is a home-based screening method that improves behavior to engage in colorectal cancer screening. The cues of action were also relevant to trigger screening behavior. Cues of action are triggers that prompt engagement in health-promoting behavior. In this DMP project, cue to action was achieved by using reminders for clients who were due for colorectal cancer screening to ensure self-efficacy of performing home-based FIT screening. The nurses educated the patients on the procedure. Methods and design. The DMP project utilized a retrospective comparative design to evaluate the effectiveness of FIT to increase colorectal cancer screening completion rate before and after the intervention. Aggregate data was retrieved from the site's electronic health records and recorded in a self-developed Excel data collection sheet. The variables in the Excel data sheet were carefully chosen based on the primary variables mentioned in previous scholarly works. Retrospective comparative design allowed the principal investigator to gather pre-intervention and post-intervention aggregate data from the site's EHR. The pre-intervention data consisted of colonoscopy screening data, while the post-intervention data consisted of FIT and colonoscopy intervention. A pre- and post-intervention design allowed the principal investigator to compare the colorectal cancer screening completion rate before and after FIT intervention, which answered the DMP Picot's question. Among active and retired military personnel and their dependents, how does colonoscopy and FIT combination compare with colonoscopy alone in increasing colorectal cancer screening rate? Sample. The age of participants ranged from 45 to 75 years of age, aligning with the United States Preventive Service Task Force 2021 recommendation for colorectal cancer screening. Participants were males and females who were due for colorectal cancer screening and had not previously been diagnosed for colorectal cancer. Participants were excluded if they had been diagnosed with colorectal cancer, if they were symptomatic for colorectal cancer, and if they were admitted in palliative or specialized care. A total number of 61,224 participants were due for colorectal cancer screening in the pre-intervention period, out of which 73%, totaling 44,957, were screened, and 27%, which the number of 16,267, were not screened. A total of 119,981 were due for screening in the post-intervention group, out of which 73%, totaling 87,769, were screened, with a combination of FIT and colonoscopy, while 32,212 were not screened, giving a percentage of 73% that were screened in the post-intervention group of combination FIT and colonoscopy, and 27% were not screened. Data analysis. Data was analyzed by the Maryville University statistician, Mr. Powles. A two-sample Z-test was performed for pre-intervention and post-intervention data. Moreover, the upper tail Z-test was conducted to determine whether there were any significant statistical difference between the proportion for the pre-intervention group, which is colonoscopy only, and the post-intervention group, which is colonoscopy and FIT combined. The upper tail Z-test was chosen because it enabled the principal investigator to evaluate the colorectal cancer screening completion rate between the participants who received colonoscopy intervention alone and FIT plus colonoscopy intervention, and further determine if there were any statistical differences. The results enabled the principal investigator to determine the effectiveness of FIT in increasing colorectal cancer screening completion rate. Results. The colorectal cancer screening rate proportion between pre-intervention group and post-intervention group was relatively similar, at 0.7315 and 0.7345, giving a 73.15% and a 73.43%, respectively, with a difference in proportion of negative 0.028. The upper tail test was performed to determine whether there were any significant statistical difference between pre-intervention proportion and post-intervention proportion. The results showed that there was no significant statistical difference between the pre-intervention group and the post-intervention group. The Z-test equaled negative 1.2641 and the p-value of 0.8969. Our analysis indicated a small and negligible effect size, suggesting that the study design could not detect small changes due to FIT intervention. The limitations. Although the DMP project had a large scale sample size of 61,224 for the pre-intervention and 119,981 for the post-intervention group, it found no significant statistical difference between pre- and post-intervention groups, as would be expected. The result could be attributed to a shorter duration of implementation of the FIT intervention. Since 8 weeks was not enough for producing a large effect size, future studies can consider longer durations, preferably 1 year. Another limitation of the DMP project is that the study participants were prone to frequent deployments, transfer, reassignment, and movements in and out of stations for assigned duties. These events can potentially lead to a low return rate for kits, significantly lowering the effect size of the intervention. Lastly, active and retired military personnel and their dependents have different statuses, which may conceal the true effect size of the intervention. Discussion. This DMP project did not find any statistically significant difference between the pre-intervention and the post-intervention groups. The findings suggest that FIT intervention did not increase colorectal cancer screening among active and retired military personnel and their dependents. Therefore, there are no detectable differences in colorectal cancer screening completion rate between colonoscopy alone and colonoscopy and FIT combination. The findings can be explained in terms of previously scholarly studies. A randomized controlled trial study by Ruler et al. 2024 found that FIT program can increase colorectal cancer screening rate when combined with other strategies such as introduction letter, a minimum of 2 reminder letters, and FIT kits with instructions on deadlines for return. The study did not achieve the expected increase in colorectal cancer screening rate since it did not employ other strategies to increase FIT uptake except mailing of FIT kits and ordering during annual physical by the providers. Similarly, another study by Lee reported that FIT program can increase colorectal cancer screening rate if the intervention is sustained for several years. These findings suggest that the DMP project needed more than 8 weeks of implementation to produce large effect size. A randomized controlled study by Martinez et al. 2024 reported that FIT program increased colorectal cancer screening rate among disadvantaged communities with poor access to colorectal cancer screening. In contrast, the active and retired military personnel and their dependents have stable access to colorectal cancer screening, compressing the space for measurable improvement. Implication for practice. Although this study found no statistical significant difference between pre- and post-intervention groups, it has clinical and nursing implications. First, FIT programs has the potential of increasing colorectal cancer screening completion rate when combined with strategies such as mailing of kits, sending reminders, and indicating deadline of returning FIT kits. Secondly, registered nurses play a pivotal role in preventive care by educating clients on the benefits of colorectal cancer screening on early detection and management of colorectal cancer. Third, facilities serving active and former military personnel and their dependents can include FIT program in the nursing workflow and clinical protocols to improve colorectal cancer screening and remove barriers to screening. Fourth, FIT program has the potential of increasing access to colorectal cancer screening, leading to early detection, which can significantly improve patient outcome. Future research can incorporate other strategies to improve uptake of fit screening. Conclusion. The DMP project was guided by the health belief model and utilized a retrospective comparative design to examine the effectiveness of FIT program in increasing colorectal cancer screening among active and retired military personnel and their dependents. Previous scholarly work showed that active, former, and military personnel prefer FIT colorectal cancer screening programs. Pre-intervention and post-intervention data was retrieved from the site's HR. The upper tail Z-test was performed to determine whether there were any statistically significant difference between the pre-intervention group and the post-intervention. The findings revealed that there was no statistically significant difference between pre-intervention and post-intervention colorectal cancer screening rate. Additionally, the findings revealed that there was a effect size. On a personal note, this project transformed my professional identity. It taught me what it means to be a scholarly practitioner. I have developed a genuine spirit of inquiry, the habit of asking why, reading critically, and never accepting the status quo simply because that is how things have always been done. If I were to do this again, I would incorporate the full suite of FIT strategies from day one, negotiate a longer implementation window at a minimum of 1 year, and critically evaluate every article for the clinical applicability to this specific population. Here are the references used for this project. Thank you for taking the time to listen and reviewing my project. I am happy to take your questions.